Hello, everyone. I'm Raman, the CTO of Carecam, and it's great to be here. Good afternoon, everyone. At Carecam, we are fundamentally redefining therapeutics. We do this by translating complexities of human motion into powerful digital mobility biomarkers. Carecam spun out of A-Star, Singapore's national R&D lab, in 2022. And within 3 years, we have gained significant traction. We are already generating revenue, and we have successfully raised over $3 million of dilutive and non-dilutive funding. Crucially, our technology is protected by 2 US patents, and we have achieved full regulatory approval for both US FDA and Singapore's HSA, making us market ready today. So why are we so focused on human movement? Because human impairment is a massive global issue impacting more than 180 million people worldwide. These are not just statistics, it's about quality of life. These impairments affect everyone, ranging from our parents who might be dealing with frailty, to neurological patients recovering from a stroke, to individuals undergoing orthopedic surgery. So this represents a significant and growing opportunity. The addressable market for just 3 main core areas of frailty, neurological, and orthopedic is over $68 billion and growing at a healthy rate of 7% annually. Our technology provides objective data that can be used across the entire continuum of care, from screening to pre-surgical planning to post-operative outcome assessment. The current approach is either very subjective, where a clinician will ask you to do this mobility test. They will use their experience to figure out if there's any issues with your mobility, and this will vary across clinicians as well. The other way to do that is using more objective way, using a motion capture or a gait lab. These gait labs will take more than $1 million for setup. They require you to wear a tight bodysuit, put on multiple nodes on your body, and then you will require an experienced technician to use these tools and provide you with an objective assessment. This makes it extremely complex, time-consuming, tedious, and essentially impossible to be used in clinical care. Our solution changes everything. We are Carecam, and this is 3D Gate. We have taken the requirement of this $1 million lab and shrunk it down into an iPad Pro. A clinician simply opens up our 3D Gate application, asks the patient to do a mobility test, and within 2 minutes gets a full detailed comprehensive report of the patient's mobility that is ready to be used in clinical day-to-day care and for actionable insights further. As CTO, this is what truly excites me. Our core platform is built on the foundation of edge-optimized AI. It starts with our 3D AI-driven core technology, where we deploy our custom-trained 2D and 3D models for real-time inference on the device itself. This is followed by utilizing the core information that we capture from iPad, including sensor data as well as LiDAR data, to make our results more reliable and efficient. All of this information is fed into the mobility analysis platform, which is then fine-tuned with inputs from clinicians and experts to ensure that every biomarker that we provide is relevant and accurate. And we are not just stopping there. The future of Carecam is this mobility AI agent, which provides intelligent feedback and recommendations, transforming our 3D Gate application from a measurement tool to a clinical partner for the clinicians. Our competitive edge is built on 3 pillars. First, we build a specialized data-driven AI model. Our models are trained on proprietary data of over 9 million points, and this is trained on variety of population data. This allows us to understand nuances in the pathological gait that the simply generic models cannot. Secondly, clinical grade accuracy. We have shown our accuracy for angular spatiotemporal biomarkers to be at the clinical grade level that is required for clinical decisions. And third, our proprietary regulated AI technology is backed by 2 US patents, 15 internal IPs, and is FDA and HSA approved. 3D Gait is the first scalable AI-based clinical grade mobility assessment solution. We enable a 99% reduction in assessment time, going from over 4 hours to a couple of minutes. This results in 90% decrease in total cost of ownerships compared to the traditional labs that are in clinics right now. We have a very clear revenue stream. We offer yearly subscriptions to medical researchers and clinicians. We work with medtech corporations for high-level B2B licensing, where we integrate our solution inside their platform. And critically, our primary model for healthcare systems is reimbursement. Our platform aligns with existing CPT codes in the US, providing a very clear and essential pathway for payments from investors. We are looking to raise $3 million for our go-to-market strategy, which will get us 5 B2B licenses customers and deploy our solution in 7 healthcare providers in Singapore and US. 62% of these funds will be deployed to R&D to expand our technology, and the remaining will be used in sales and marketing and creating a global team. This investment will unlock key milestones, including pilots with the largest primary care providers in Singapore and 1 US hospital. This will lead us to achieving $29 million projected revenue by 2029. None of this would be possible without the right team, and we have created a world-class group of operators and experts. Led by our CEO, Elson, and me, our team has deep experience in AI, 3D vision, and commercializing technologies. And we are backed by an incredible board and advisory team ranging from US and Singapore alike, who have experience in medical practice and creating $100 million companies. At Carecam, we are using human movement as digital biomarkers to expedite and personalize care. Thank you for your time. I'm happy to answer any further questions.
All right, so I'd love to start with talking about Carecam versus the existing technology that's being used in hospitals. Right, so you talked about cost, yes. I think I believe that. Time, yes. And that is clinical grade, which means that it's good enough, right? But my question is it better? Right, so let's talk about precision, accuracy, consistency. How does it score relative to the incumbent technology?
So right now, it's not about being better anymore. The technology is already good enough to be deployed in hospitals. The main barrier for this to be used in current medical practice is that it's not usable right now. The current approach to do this is either using multiple cameras or asking a frail patient to go to this special motion capture lab, which is simply not safe and not something that a patient wants to do. So our solution, which is completely portable, mobile, you can use this right now just outside this area. This is what makes it truly special. Clinicians can use it anywhere, anytime. You can use it in the clinical practice. You can recommend it and use it at their homes.
On the yearly subscription, could you just give me a bit of a number what that roughly would look like for the monetization? Then also, you mentioned it's custom models, so it's not something like an open pose, etc. Is it primarily just cameras, also LiDARs?
Yeah. So our solution uses multitudes of information that we get from iPad. So open pose and some other 2D and 3D poses are available, but they are not good enough to do what we are doing. So we had to train our own custom models to do that. In terms of licensing, our solution is deployed on an iPad. We do not need to use any servers to process. So essentially, once you have our solution on your iPad, you can use it as many times as possible for the entire year.
Could you just give a rough idea of what that would be?
It's about $15,000 for yearly subscription.
Can you share a little bit more about your go-to-market strategies? How do you scale beyond your current early adopters?
So the main requirement for it right now is to actually do proof of validation, proof of value in US hospitals to be deployed there. So this is something that we are working on this year to deploy it in a US hospital, show that there's value of it to the hospital as well as to the clinic. Once the proof of validation is done, then we can simply integrate inside the EHR system. We have already cleared the Singapore's HCC to be deployed inside and integrate our solution with the EHR.